Okay, good afternoon, everyone. Thank you so much for the opportunity to be here and to be part of this session. It's been a really great session so far. And I don't have any conflicts of interest, just want to say that up front. I am going to be talking a little bit today about my experience working in workforce development. So first I want to tell you a little bit about what that lens is. I work for APHL, the Association of Public Health Laboratories. We're a US-based NGO comprised of members from US public health labs, environmental labs, and agricultural labs. At both the domestic and the global level, our main objective is promoting laboratory system strengthening. And we do this with a mix of capacity building activities, technical assistance, etc. We have offices in 12 countries around the world, and we also work in additional countries beyond that. And at our global health team level, we have expertise in a wide range of topics, things like quality management systems, biosecurity, just to name a few. But I am specifically on our global health, NGS, and bioinformatics team. The name speaks for itself. My team focuses on sequencing, including the generation and the application of sequencing data. So I probably don't need to tell the whole room this, but something that has been really clear in my team's work over the years is that the COVID-19 pandemic was a major catalyst for expanding the capacity of sequencing around the world. You can see that in this figure, which is already very outdated, but the blue bars are showing the number of countries in every WHO region around the world with sequencing capacity in 2021. The orange is 2022. We know that it's expanded across the globe. And that's a great thing because we all know that genomics has the potential to answer some really important public health questions, not limited to transmission, outbreak, investigations, AMR, et cetera. However, sequencing and bioinformatics is really only part of the equation. This framework reminds us that impactful data really has to be integrated with other components. Specifically, we've heard a lot about metadata so far in this conference, but that's really key. Data alone isn't necessarily meaningful. It has to be linked, it has to be reported, it has to be correctly interpreted. And it really should lead to a public health response. That's the goal here. And finally, what I really like about this particular framework is that it's not just one line in one direction, but it's really reflecting the cyclical nature of this whole pipeline. It's really decisions, the decision of when to sequence, what to sequence, how many samples to sequence. It should be guided from the start with those public health relevant questions. In the context of the COVID-19 emergency response, rightfully so, we focused a lot on the left-hand side of this framework, and that makes sense. That's what we needed to focus on at the time. That focus was largely on laboratorians and bioinformaticians, and it largely excluded epidemiologists and sometimes public health decision makers. A lot of those capacity building activities were effective in increasing the amount of data generated. You can see in this figure in blue the number of SARS-CoV-2 genomes uploaded each month to GISAID. The top is globally and the bottom is broken down by high, middle, and low income countries. So clearly we had some success in generating the sequencing data and uploading it to databases. However, I really like this quote by Bill Foege, former US CDC director. He says, "The reason for collecting, analyzing, and disseminating information on a disease is to control that disease. Collection and analysis should not be allowed to consume resources if action does not follow." So I think the question that remains here is, to what extent are we utilizing all of the genomes that we're sequencing to further public health? And clearly, the answer is yes, we're doing a great job in some case studies. I'm sure we're all familiar. We've heard a lot of them reflected in this conference so far. Outbreak investigations, food recalls, et cetera. We know that there are specific examples of when this is really well done. But I think there are also examples of when sequencing just occurs and isn't necessarily used to its fullest extent. In this current climate and political world that we're in, I think it really is important to think about how we can improve that aspect. And even without having a quantitative study about how well we do at this, I can anecdotally reflect on some of the things I see. And one of those is a major gap, a major silo between lab and epi. I think this is true around the world. It's definitely true in the US. It's true in a lot of places that I work. And this is evident by the responses I get when I ask labs something like, so what happens with the data after you generate and analyze it? And I've heard things like, we share the report with epi, but we don't know what they do with it. Or, we've never heard back. Or, I don't think they know how to interpret it, but they've never asked us. Or just, that's outside our scope. Clearly, this is a problem that has the potential to reduce the actionability of sequencing data. And as we move into our next phase of workforce development activities, I think it's going to be really critical to address this whole cyclical continuum, including epidemiologists, including decision makers, expanding beyond laboratorians and bioinformaticians, and focus on this whole system. So there's a lot of valuable approaches. There's not just going to be one perfect puzzle piece that solves all of this reducing silos. It's going to be a mix, and it will look different everywhere. But one thing that I want to share that has been helpful in my work so far is the role of tabletop exercises as a method to bring these two teams together, introduce them to each other, and demonstrate that together they have the skills to solve complex problems. So in 2024, my team developed a mock outbreak tabletop exercise, and we've since led tabletops in Honduras, Paraguay, and Guatemala. Next week, we have another one planned, although that one's a wastewater-focused one, for regional training in Zambia. The specific foodborne outbreak investigation that we developed, it walks participants through all the steps in an outbreak response, starting with a fake email from a hospital physician reporting a suspected outbreak. Participants together have to confirm the outbreak, identify more cases. They go through a food history questionnaire. They conduct a case control study. They interpret odds ratios. But really the crux here is that it requires sequencing to really yield anything, some important results. Specifically, at the first pass of the case control study, there's no significant association between any food and the outcome of having listeria. It requires looking at the sequencing data to identify that there is a cluster of genetically related isolates and also some other ones that are just red herrings and not related to the outbreak at all. So it's that process of integrating the genomic data, reanalyzing the case control study, that finally leads to solving the outbreak. Throughout the exercise, participants work in small groups comprised of both lab and epi staff. It encourages them to build relationships with each other, and in my experience, that has sometimes been for the first time that they're meeting. The critical takeaway for everyone is that neither epi nor lab have all the information by themselves to solve the outbreak, but together they're better than the sum of their parts. And in addition, it just helps build a common language. Laboratorians are exposed to what epi methods include, and epidemiologists are exposed to what sequencing can answer, what that timeline looks like, and most importantly, how methods like sequencing, phylogenetics actually complement traditional epi methods and should be used together. So in the tabletops we've led so far, participants have self-reported things like appreciation for the skills of their counterparts, gratitude for meeting each other, sometimes for the first time, and this new understanding of how epi-lab collaboration is ongoing. It's more than just a one-time report handoff, it's an ongoing dialogue. And finally, an understanding and a practical experience of what it looks like to use genomic data collaboratively in the context of an outbreak. So in summary, we're entering this next era of workforce development where so many gains have been made in the last 5 years. Many of my colleagues presented before me have already acknowledged the fact that we need to start thinking about things besides lectures, besides just curriculum. And I would expand on that and say we need to think about other audiences to include groups like epidemiologists, policy decision makers, because it requires that whole community to really be successful at genomic epidemiology. Finally, I think I would love to share resources and also hear from everybody about what strategies have worked for you in reducing those silos. I think there's going to be a lot of things that work, and I think it could be really, really helpful if this community also shared those sorts of anecdotes going forward. So thanks for your time. Here's my email address. Feel free to reach out.